Hello and welcome everyone. Glad you're joining us. We will give people a moment just to log in, get comfortable, grab your lunch or a coffee, tea, water, make yourselves comfortable for our webinar. And we'll get started in a moment. Feel free to say hello in the chat. We'd love to know who's here today. Okay, folks are still joining us, but we'll get started knowing we just have you over a short amount of time today. So hello and bonjour, depending on your location. Good morning or good afternoon. Welcome to another KDE Hub webinar. And we also welcome first-time attendees to our webinar as well. We're excited that you've chosen to join us today. So our session is titled Strong Pathways, Building More Responsive Systems for Newcomer Mental Health. And my name is Alice Schmidt-Hanbidge. My pronouns are she and her, and I'm the scientific co-director of the KDE Hub, along with my colleague, Dr. Colleen McMillan. Say hello, Colleen. There we go. Hi there. And she'll be providing some closing remarks at the conclusion of our webinar today. So before we begin our exciting topic for today, I have a couple of announcements to share with you. So one is that the webinar will be recorded, and we'll also have an event brief, a webinar recording, and slides that will be shared with you via email. Throughout the session, we also encourage you to participate by sharing your questions and comments in the chat. And we'll also have time in the question and answer session after the presentation to address questions. As part of our shared spaces and commitments, we'd like to situate ourselves in the land that the webinar is hosted on today. So on behalf of the KDE Hub, I'd like to acknowledge that on the land that we're gathered here today, and we're gathered virtually at Renison University College, which is affiliated with the University of Waterloo, and it's located on the ancestral unceded territory of the Anishinaabe, the Haudenosaunee, and the Attawandaron peoples on the Haldimand Tract. This land was promised to the Six Nations and includes 6 miles on either side of the Grand River from mouth to source, which is in southern Ontario. We recognize that you as participants today, you live in areas across the country. So again, please say hello in the chat and indicate where you are residing. As a mental health promotion organization, we at the Hub strive to support mental health and well-being in a way that respects and incorporates Indigenous perspectives and experiences. We continue to acknowledge the ongoing impacts of colonization and systemic inequities on Indigenous mental health, and we are dedicated to fostering an environment of inclusion, of respect, and healing for all communities. We recognize that the work remains to be done in advancing decolonization and reconciliation. So thank you. Our topic today, the conversation brings together diverse perspectives on how we can strengthen mental health supports for newcomers, with a focus on prevention, on early intervention, and collaboration across systems. Newcomer children, youth, and families often faces unique challenges as they adapt to new environments, languages, and cultures, while also managing the impacts of migration and trauma. Our goal today is to explore how schools, communities, and service systems can work together to build a more responsive, inclusive support that promotes resilience and belonging. One initiative leading this work is STRONG, which stands for Supporting Transition and Resilience of Newcomer Groups. And STRONG offers an evidence-informed school-based program that helps newcomer and refugee students build coping skills, resilience, and connections as they adjust to life in Canada. This program offers a strong example of how prevention and early intervention can be embedded within everyday school settings to support newcomer well-being. So with that, I'm pleased to introduce our speakers who will share their experiences and insights and how STRONG can help shape more responsive pathways for newcomer mental health. So please welcome our strong speakers, Dr. Amanda Carey, Reem Banat, and Gina Casey. Over to you, and we're so glad you could join us today.
Hi, thank you so much, Alice. So just as we are pulling up our slides, I'd like to welcome everyone and thank you for sharing your lunch hour with us or your morning or afternoon, wherever you're joining us from. Apologies in advance for my voice, and I will try to keep my coughs to a minimum. I'm just dealing with a bit of a cold, as I'm sure many people on the call also are. But it's always so encouraging to see so many people join these webinars. I was seeing in the chat, there's people from all across Canada, and it's so promising to see and be surrounded with other people who care deeply about supporting the mental health needs of newcomers. And it's my pleasure to introduce myself and our team. So my name is Dr. Amanda Carey. I'm a clinical and forensic psychologist, and I have many different roles as a psychologist. But one that I'm very proud of is my work and involvement with Western University and the STRONG program. And my role with the STRONG program includes delivering trainings, providing clinical supervision to our wonderful graduate student clinicians, and also working with Gina and Reem to help build and maintain our community partnerships. And I will pass it to Gina and Reem to introduce themselves.
Wonderful. Thank you, Amanda. I just want to make sure everybody can see my screen. We're good? Okay, perfect. Lovely to have you all this afternoon during your lunch hour. We're really privileged and fortunate to be able to spend this time together and share some of our work that we've been doing over the last 5-6 years. For myself, I've been the project manager at the Center for School Mental Health since 2019, really supporting the evaluation and the community implementation of the intervention. I bring my background is really in political science, and I've been also fortunate to be able to work in community organizations on the front lines, also supporting newcomer population. This work is really meaningful to me, and I appreciate all of your attendance today.
Okay, good morning or good afternoon, everyone, based on where you're joining us from. My name is Reem Banat, and I work at the Center for School Mental Health with Amanda and Gina, and I'm the STRONG Research Project Coordinator. And I've been there for around 3 years, and I work closely with Gina on the evaluation of the STRONG program. It's so lovely to see you all today, and I'll pass it back to Amanda.
Thank you. So this is a really important and really big topic. Really and truly, we could spend an entire day talking about this, but for this afternoon, we're going to narrowly focus on providing you with a brief overview of newcomer mental health, introducing you to the STRONG program, and also discussing the important roles and lessons learned from our cross-sector collaborations. And as part of our work at the Center for School Mental Health at Western University, one of our focuses is research and evaluation, as Reem was mentioning. And that focus really helps us to make data-driven decisions to guide our planning and our initiatives. And it's always helpful to understand who's joining us today. So we'd like to take a quick pause, and we'd invite you to complete a couple short poll questions just to give us a better understanding of who's joining us this afternoon. In terms of really understanding and appreciating the unique mental health needs of newcomers, we find that it's really helpful to encourage people to think about the different stages of the children, youth, parents, and their families, their journey of coming to Canada. And often we can think about it in their pre and post migration. And during this journey, young people and their families unfortunately might be exposed to different adverse experiences that can affect their mental health. So very briefly, and again, this in and of itself can be an entire presentation. Some of the pre-migration adverse experiences might include in their home country being exposed to poverty, persecution, war, violence, and in the process of moving to a new country, so during their transition, they might also experience or be exposed to, I love keep the emojis and interactions going. It helps make us feel closer and more connected when we're virtual. Thank you so much. During their journey, they may be exposed to hazardous or unsafe travel conditions with limited access to food or water. They may have to spend a period of time at a refugee camp, maybe unfortunately experience mistreatment from authorities. And during their transition, they may be exposed to continued violence. And post-migration, so this is now once they've moved to Canada in our context, may be experiencing financial hardship, isolation and discrimination. They may be dealing with the loss and separation of being away from loved ones that are still in their home country. Another example is we often see role reversals where the child or teenager is the one who is being relied upon by parents to be a translator, which can induce a shame response for parents, but it can also be a lot of stress and pressure on the children and youth. And what we do know as well is these adverse experiences, we see a cumulative effect, meaning that the more adverse experiences that these families have to deal with in the absence of adequate coping skills or adequate supports, that can lead to a greater impact on their mental health. And we'll speak a bit more to that on the next slide. And when we look at this visual, it really highlights that given the potentially stressful experiences during the stages of their migration, children and youth and their parents may develop mental health needs. And often when we have referrals for the STRONG program, these are the kids that are described by their parents or school staff as isolating themselves in their bedroom, avoiding school, getting into fights with their peers. They struggle to make friends. And so those are really the observable behaviors that are depicted at the top of the iceberg. Those are the things that we can see and hear. And really important that we try to carefully understand what's depicted on the bottom half of the slide. So what's underneath these behaviors for many of these newcomer youth. And for many of them, sadly, it's trauma responses that are driving these behaviors. So they're easily overwhelmed. They're not sleeping well because of nightmares. Outwardly, they may seem distracted, and it's actually because they're very hypervigilant and they're constantly scanning their environments for threats, which is really exhausting. Heightened anxiety, feeling lonely or low self-worth, feeling excluded, and oftentimes feeling embarrassed for being perceived as different because of their language or their accent or clothes or the food that they're bringing to school for lunch. And in terms of mental health diagnoses, so reaching the point of clinical significance that it warrants a diagnosis, we know from the research that young people who are newcomers often experience higher rates of post-traumatic stress disorder, depression, and anxiety. So again, very briefly to share a couple of stats with you, we know from the research that young people who are resettled refugees, it's estimated that the rates of post-traumatic stress disorder or PTSD is upwards of 54%. And that's significantly higher than the general population of children and youth, where we see rates of PTSD anywhere between 3 to 5%, so much higher. And also rates of depression among resettled refugee young people is as high as 30%. And when we compare that with the general population of children and youth, we see an average rate of about 11%, so much greater needs. And I very quickly want to touch on, and we don't have enough time today to fully capture the extraordinary strengths of these young people, but equally important to understanding their mental health needs that's highlighted here. It's equally important to really recognize their strengths, which, just to name a few, include their sense of humor, their compassion and empathy, and their ability to speak multiple languages, which I certainly can't do. So there are many strengths that we want to highlight as well. And there can be many challenges and gaps and barriers to getting support to address their mental health needs, which unfortunately results in a persistence of mental health symptoms. And these include language barriers or structural barriers such as underfunded programs or long wait times. And the STRONG program was developed to try to address some of those gaps and barriers. And so I will pass it to Gina to tell you more about the STRONG program.
Wonderful. Thank you so much, Amanda. So like we said, STRONG stands for and is short for Supporting Transition Resilience of Newcomer Groups. The program was designed in and of itself to promote the resilience and well-being of newcomer children and youth who are specifically experiencing challenges as they adjust to new schools or environments and communities, or are having difficulty with their peer relationships as well. So the program itself as well is really focused on supporting newcomer children and youth to build these coping skills, to build their confidence, and to strengthen peer relationships as they navigate the transition to their new environment. And like Amanda said, we recognizing the fact that there might be challenges and there are specific referrals for the reasons why they were referred to the intervention. We also, the program itself really focuses on identifying and nurturing the unique strength that the young people had to utilize in their journeys thus far. So not only are we focusing on unique strength and also teaching practical skills to make positive choices, and really focusing on fostering a sense of belonging and connection. So really combining the resilience building, the skill development, and those social emotional learning. STRONG is focusing on supporting newcomer children and youth to adjust and also thrive in their new environments. In terms of the history of the intervention, the development of STRONG began in 2016 when Ontario schools saw a rise in numbers of Syrian students that were welcomed into the Ontario school boards. And specifically, educators and mental health professionals in those school systems had identified that as they're trying to support these young people, there's evidence that there's signs of distress. And although there are a lot of welcoming supports and universal supports, there isn't as much targeted interventions that meet the needs of newcomer students that are exhibiting signs of distress as they adapt to their new environments. So upon consultation, School Mental Health Ontario spearheaded this work to help schools better promote student mental health and well-being, and they identified that there is a clear need for specialized programming. So the intervention itself was co-developed by School Mental Health Ontario, Dr. Sharon Hoover from the National Center for School Mental Health at the University of Maryland, and the Center for Childhood Resilience in Chicago. And our team at the Center for School Mental Health joined in 2016 when we were invited to lead the evaluation and help build an evidence-based for the results and impacts across Ontario. So we are fortunate to have international peers that are also working on implementing STRONG in their community and school settings in the States. And we've been fortunate to be able to do this work as well in Ontario. And I think what's really important to note about STRONG is, unlike many programs that are typically adapted for different populations, the intervention itself was co-created with consultation with newcomer populations, and really focusing on newcomer populations to ensure cultural relevance and authenticity. In terms of where the intervention sits on the multi-tiered system of support, STRONG is considered a tier 2 intervention designed for newcomer children and youth that are exhibiting mild to moderate social, emotional, or behavioral challenges. Like we said, oftentimes in school settings, there's a lot of tier 1 supports where are universal supports, so that are focusing on all students, but there's not necessarily targeted small group supports for students that need additional support, but not as intensive as individualized therapy. And that is where Strong sits in this system. So it's really focusing on early identification and prevention to be able to help bridge that system of support. In terms of the referral pathways for newcomer children and youth, typically when settlement organizations are providing support for newcomers, it's situated according to a specific time limit. So if you've been here longer than 2 years or 3 years, those supports are no longer extended to this individual. But we recognize in the school system and even in community that these challenges are really experienced past a specific timeline. So when the program was designed, we were very intentional as well to make sure that there's no restriction based on immigration status or time spent in Canada. So we've had various young people refer to the program irrespective of that, of those two factors. And what's important to also highlight regarding Strong and the way that it was developed is it really draws on CBT, so cognitive behavioral therapy. But I think what's really important as well to identify is the fact that CBT often focuses on changing thoughts of an individual, but really with Strong, there's also a focus of acknowledging that there are systemic barriers and stressors that are placed on young people, such as discrimination and racism. So it's also the responsibility of the system, not the individuals, to change. There's a focus on strength-based, like we said, highlighting that what newcomer children and youth bring. Their languages, resilience, all of the skills that have that they carry with them. And lastly, really looking at the fact that it's trauma informed. So focusing on emphasizing choice and collaboration throughout the process of the intervention, so that way participants also feel safe and empowered throughout their participation in the program. In terms of just a quick overview of the structure of the program, it is a manualized program and it's offered both for elementary ages and secondary ages. The program itself has 10 sessions, so each session is an hour, and it focuses on the different topics like we talked about. And the program as well is facilitated by mental health professionals that are trained to deliver the intervention. And sometimes it's co-facilitated with supporting roles such as ESL teachers or youth workers. But one of the facilitators has to be a social worker or a psychotherapist or a psychologist, mainly for the fact of as well, there is an individual session that the young person sits with the mental health professional and their facilitator and are able to relay their journey narrative in a strength-based manner to identify the strengths and supports that they utilize in their migration journey. And during that individual journey narrative, it's an opportunity for the mental health professional to also do a PTSD screen. So if there's a need for individualized Tier 3 supports, that can also be something that is recommended post participation in Strong. I'll turn it over to Reem for the research. You're muted.
Right. Thank you, Gina. Now that Gina has introduced the program and its structure and goals, I want to talk a little bit about the research that we do at the center to evaluate the impact of the program. And it's important for us to implement these evaluation activities because when developing and implementing a mental health intervention with marginalized populations, such as the newcomer populations that we are working with, we are ethically responsible to evaluate its effectiveness to ensure that we are not causing any harm and to continuously engage the population to modify the program the content, and the design to strengthen it and ensure that it is constantly relevant and is benefiting the population that we are dealing with. And so to evaluate the program, we conduct research activities with the children and youth participating in the program, with their parents and guardians that are participating in the parent sessions, and with the group facilitators as well. In our research with the children and youth, we really want to understand the impact of participating in the program on their mood, their coping skills, and well-being. And we also want to understand from their perspective what they think are positive aspects of the program and if they have any recommendations for improvement. Now, with the parents, we aim to understand two things. The first is we want to know from their perspectives as parents and guardians how the program is impacting their children's mood, coping skills, and well-being. And we also want to get their feedback on participating in the parent sessions. So what they consider are successes, challenges, and if they have any recommendations for us to improve those sessions. And finally, we also implement activities with the program facilitators. So again, here we want to understand from their professional perspective, the impact of the program on the children and youth. We also want to know in terms of implementation, what successes they have seen and what are some challenges to implementing the program. And we also want to see how facilitating the program impacts their own professional growth and development. And so from 2020 up until now, we have conducted evaluation activities with 14 strong groups. And in the next couple of slides, we're kind of going to discuss some of the results that we have seen till now. And so to evaluate the intervention with the children and youth, we ask them to complete a survey before participating in the program and after, and also to participate in a focus group discussion at the end of the program. And so from the data collected from the surveys, we have seen a change in their reported social, emotional, and psychological well-being, and also in their symptoms of depression and anxiety. The children have also shared that these skills, the relaxation skills that they have learned in the program, help them with managing their emotions. And they also shared that they would recommend the program to other newcomer children and youth because they feel like it will help them learn coping skills and problem-solving skills. For the parents, we ask them to complete a survey at the end of the program and also to participate in the focus group discussion. And with regards to the impact of the program on their children, we have seen that they reported that the program has been helpful for their children because they seem less worried, they're happier, better able to regulate their emotions at home and have more positive interactions with their siblings and with their peers at school as well. And in terms of the parent sessions, they have shared that they have participating in the sessions helped them better understand their children's emotions and behaviors, and it also equipped them with strategies and information to better be able to support their children at home. And the parents would also recommend the program to other parents or guardians of newcomer children and youth. And then finally, with the facilitators, they have reported growth in their professional skills and their perceptions and attitudes about newcomer experiences. They've also reported that after facilitating the program, their understanding of the barriers that newcomers face in accessing mental health services increased. They also learned more about different cultures and the unique needs that newcomers have when coming to Canada. And also facilitating strong helped them gain more in-depth knowledge about trauma-informed CBT interventions and how to adapt these psychological interventions so that they are culturally relevant to the populations that they are working with. And finally, they learned how to have wider conversations about systemic levels of oppression and racism that lead to mental health difficulties. So we have seen some positive feedback about the impact of the intervention on the newcomer children and youth, their parents, and the facilitators. And so this is something we will continue to do to remain accountable to the program that's being delivered. And now I'll pass it back to Gina for the second portion of the presentation.
Thank you, Reem. So I think in terms of when we were structuring this presentation and really thinking about the topic that we wanted to share with you all, we're more thinking about, like we said, the pathways and the systems that have been that are at play to be able to support the well-being of newcomer children and youth and families. So really, when we ask this question, and we always pose it to ourselves as well as a team internally, as to who are the key players that we are responsible for inviting to the table as we do this work, who's responsible for supporting the well-being of newcomers. And it's in recognition of the fact that no system or no key player can do it alone. The well-being of newcomers, of children, youth, and families is shaped by multiple systems that they're navigating on a day-to-day from when they land here and upon several years into their integration. We're recognizing for that their well-being is shaped by the education system, which provides belonging and really a lot of entry points to services for families and children and youth. The health system, the settlement sector, which helps also families navigate the social services system as well, to name a few. And each system, like we said, touches a different part of the newcomer experience. But if each of these systems are working in isolation, families are left unsupported, and the impact and the reach that we're able to address is a lot more limited. So we really recognize that supporting the newcomer well-being in general requires shared responsibility and intentional collaboration across these sectors. And the next portion of our presentation really focuses on these key agents and players that we've had to seek collaboration and partnership with to be able to carry out the work in the ways that we find are meaningful, and to be able to support and ensure that newcomer children, youth, and families feel seen and supported and able to thrive in their new communities. So some of the key players and agents that we want to touch on today regarding the cross-sectoral collaboration that we've recognized and structured. And this is an evolving process as well. So we have these puzzle pieces that are also unlabeled and, coming at play, because as you build the system in a meaningful way, you recognize that there's different key players that you can also invite to the system. In the scope of our work over the last 6 years, supporting newcomer mental health has required a lot of strong partnership and collaboration across the public health system, the education system, evaluation and research training partners, mental health providers, and settlement organizations. We're going to be talking regarding each of these key players, the main opportunities and challenges in building responsive pathways to support newcomer mental health. Each key player we've seen and interacted with plays a distinct yet very interconnected role in promoting mental health and ensuring accessibility and fostering collaboration. And we hope that through all of these key systems, we're able to create this foundation that we've built over the last several years to continue creating coordinated and culturally responsive and hopefully sustainable supports for newcomer children and youth and their families. So to start off, for one of the key players and to situate ourselves in this role, as the Center for School Mental Health, our work has really focused outside of this project and in general on promoting the mental health of children and youth through research partnerships and knowledge mobilization and training. We've been fortunate to be able to collaborate and work with many partners across different sectors and to build evidence, an evidence base regarding the intervention that strengthen mental health supports. One of our greatest opportunity in the work that we do is really the expertise that we bring together. We're able to bring together educators, clinicians, researchers, and community partners to do this work. And we really pride ourselves in the fact that we have to be highly flexible and responsive to the feedback that we receive. Ideally, we know that a lot of scientists and researchers like to carry out their work in labs and be able to create polished outcomes, but we pride ourselves in recognizing that the work that we do is grounded in real life with individuals that we want to make sure that we're accountable to, like Reem said. And that requires us to be very flexible and responsive to feedback and adapt as we go. Some of the challenges that we face as we are carrying out this work in mental health promotion is we're recognizing that there's a rapid growing need for newcomer mental health supports. We've seen other sectors getting strained or getting limited funding. So this need has kind of trickled over to us as well, recognizing that we find ourselves in this opportunity to bridge a lot of different partners. So that way you're able to pool resources and leverage a lot of human capacity as well to carry out this work. But at the same time, too, we're trying to create these partnerships while also addressing the service provision and the needs of newcomer families that are in real time and essentially happening and require a fast response. So I think these are some of the challenges that we're also facing. In terms of our work with Public Health Agency of Canada as the funder of the Mental Health Promotion Innovation Fund, and just really what has been given us the opportunity to carry out this work. We recognize that their role is focusing on preventing disease and injury and promoting health and well-being and equity. And in advancing newcomer mental health, FAC has had several key opportunities. From the fact that there's capacity to advance national mental health promotion and health equity, and in the way that the funding streams are orientated and structured, and where resources are channeled, that really supports the work that we're doing in order to be able to create responsive pathways for newcomer mental health. And I think there's a very intentional focus on upstream prevention and early intervention, which allows programs like Strong to also be funded. So that way we can really focus on alleviating some of the long-term burdens on provincial health systems and reducing, young people having to access Tier 3 or individualized interventions. And lastly, through Public Health Agency of Canada and the KDE Hub, there's really an intentionality as well to create a knowledge base, to be able to connect all of our projects, to be able to as well capture some of the outcomes and the impacts of knowledge regarding newcomer mental health, which needs growing evidence, especially within the Canadian context. I think in terms of challenges, we've been fortunate to be able to be funded for the last 7 years through this funding stream, and we recognize that at the end of the day, this work requires many years and decades of investment and collaboration. So sustainability and scale is something that's an ongoing conversation of how do we continue to build these systems and connect them to be able to carry out and promote newcomer mental health. And last, and I think there's really an importance around collecting the data and making sure that you're able to provide the impacts that are being carried out for newcomer children and youth. And that requires as well a lot of investment and intentionality. And then lastly would be recognizing that alignment and creating these partnerships and and collaboration also requires alignment through different systems, which sometimes mental health care really falls on provincial mandates. So on a national scope, you have to also involve and integrate the necessary key partners to be able to carry out these work. So these are the opportunities and challenges that highlight FACT's pivotal role in shaping a coordinated and equitable approach to newcomer mental health in Canada. And I'll turn it over to Reem to speak to some of the other key players that are also involved in this process.
Thank you, Gina. So we have identified School Mental Health Ontario and school boards as key players because of their role in recognizing that students' mental health and school success are interrelated, and that their work focuses on mental health promotion, prevention, and early intervention. So we have a strong partnership and cross-sharing with School Mental Health Ontario because they are the key player that is responsible for the delivery and evaluation of school-based mental health interventions. And in the context of STRONG, they do implement the STRONG training for mental health professionals in schools. And school boards were identified as a key player as well, as they are often the first point of contact for newcomer children and youth. And therefore, it is a helpful setting to be able to identify any concerning behaviors or distress. And so the opportunity here was that STRONG was developed specifically for schools because of this, because of it being the first point of contact for the newcomer children and youth. And the program is aligned with the needs of the school mental health professionals to be able to support the newcomer children and youth that they're serving within the program and within the school context as well. But there are some challenges with the uptake of STRONG across school boards due to the different priorities that every school board has and the resources and time that they have to implement the program. And so time and resources are sometimes an issue when deciding to implement the program or not, because the schools have a lot of competing demands to implement academic or other school services and programs. So sometimes this creates a challenge in the implementation of STRONG. So school boards are a key player and have a great role in the implementation of STRONG and the support of students' mental health and well-being, but there are challenges as well. And the next key player that we have identified are the newcomer settlement organizations because of their focus on resettlement and integration supports for newcomer families. So these organizations already have established connections with the newcomer populations that they serve, and they are seen as a trusted source of support and information for these families. And these organizations usually all have linguistically diverse staff that are able to support the newcomer populations with different language needs. And the staff also possibly have lived experiences of migration, so they have more information or knowledge around the barriers that these populations face when migrating to Canada or to access any mental health services. There are some challenges that are faced to implement the program in newcomer settlement organizations due to their limited capacity to provide mental health services. So these organizations do not always have a licensed mental health professional as part of their staff. So that might limit their ability to provide these mental health services. And of course, they have limited funding. And so funds are sometimes directed towards certain programs. So they're not always able to find the funds to implement the program. And they always have high demands as well. So newcomer organizations, we did identify them as key players due to their pivotal role in supporting the mental health of newcomer populations, but they do face some challenges like the school boards as well to implement the program. And I will pass it on to Amanda to discuss our next key players.
Thank you. So another important key player in doing this work are the child and youth mental health organizations that exist in the community. And these are the agencies that are mandated to provide individual and group-based mental health services for children, teenagers, parents, and families. And These agencies can vary in size from smaller community organizations to larger agencies, which are often referred to as a lead agency. And as Reem mentioned, one of the really extraordinary strengths of settlement organizations is the robust knowledge and experience supporting newcomers. However, in those agencies, there's a gap in having regulated mental health professionals. And on the flip side, when it comes to looking at organizations for child and youth mental health, we're fortunate to have a lot of mental health expertise where there's social workers, psychotherapists, psychologists, behavioral therapists who have a really broad experience and knowledge base in supporting the developmental needs of children and youth. However, there is a gap in their training and experiencing in understanding and addressing the unique vulnerabilities and mental health needs of newcomer children and youth. And so highlighting that to show how, although there are gaps in both organizations, working together, the two complement each other really nicely. Another opportunity of these agencies is generally they have consistent funding, not always the case, but often. And some of the challenges when it comes to partnering with these organizations and having them be able to support the needs of newcomers is these agencies often have really long wait lists to receive mental health services. And again, as I mentioned, although they have a general knowledge of the social and emotional needs of children and youth, it's limited in terms of understanding the unique needs of newcomers, which then trickles into affecting the mental health professionals' sense of competence and readiness to work with this population because they feel like it's outside of their area of expertise. And one of our last key partners that we wanted to highlight is psychology training clinics that are often embedded in part of universities. And these clinics provide clinical training to master's and PhD psychology students. And through these clinics, we're also able to provide accessible psychological services to children and youth and parents because the psychological services are delivered by trainees under clinical supervision. And with that, we're able to offer really high quality psychological services on a sliding scale, which can make it more financially feasible. And some of the important opportunities or strengths of these partnerships, again, similar to on the last slide, is these clinics have a lot of mental health expertise when it comes to children and youth. These clinics often also have leadership support, which helps us deepen these partnerships. And it's an opportunity for graduate students to receive facilitator training in the STRONG program and also actively participate in and receive culturally responsive supervision, which strengthens their cultural competencies. And those are cultural competencies that they can take with them after graduate school and continue to use with future clients, which is really important. And another important opportunity that I'd like to highlight is in partnership with the STRONG program, we're also able to extend the psychological services that we offer. And what I mean by that is we've had young people who have graduated from the STRONG program and are continuing to present with some mental health needs, and we're able to offer them psychological assessments and additional individual therapy through our psychology training clinics. And some of the challenges to highlight is, although there is a lot of mental health expertise, again, there's limited experience and knowledge of newcomer populations. It can be a challenge. Graduate students are busy. They have many competing demands of academic and training opportunities. And so it can sometimes be difficult recruiting students to be involved in the program. And because these are trainees and aspiring psychologists, they're not yet autonomous clinicians. That means they require more support and clinical supervision, which is part of the learning trajectory. And that's actually one of my favorite parts because I've had many incredible mentors, and it's lovely working with the graduate students because they are quite eager to learn. And lastly, just to highlight, and this has kind of been the common thread throughout our presentation, as Gina mentioned, around shared responsibility and intentional collaboration to really effectively and systemically remove some of the barriers and provide these children, youth, and families with accessible, equitable, the high quality services that they deserve. It truly takes a village, including individuals and organizations who are invested in supporting the well-being of newcomer families, and working together to build on each other's unique knowledge base and expertise. And again, it really helps to kind of create a bit of a warm transfer and a bridge where if a family is receiving support with a settlement agency and they feel trusted and supported by that agency, they're more likely to trust and pursue a referral to another organization, thanks to the cross-sector collaboration. And lastly, before we open it up for questions, we'd just like to invite you to complete a few feedback questions. And again, this is to help us to continue to improve our training offerings. And just as people are completing those poll questions, I will share with you a couple pictures of the wonderful work that our team has done across Canada and internationally with our partnerships and collaborations. These are pictures with the strong team and various school boards, community organizations, as well as the top right-hand picture is actually our strong team in Czech Republic and collaborating with clinicians who support Ukrainian children and youth. And we just wanted to extend our gratitude. Thank you so much for spending an hour of your Wednesday with us. If you're interested in learning more about the program, please visit our website, which has lots of resources available. And also don't hesitate to reach out to us if there's any questions. And if there are any, I don't think I saw any questions in the chat. I was trying to keep an eye on it, but if there are any questions we can answer right now, happy to do that.
Yeah, thank you, Gina, Reem, and Amanda. And before I officially thank you, I do see a couple of questions in the chat. Yeah, so would it be okay if I just read them out? Yeah,
Sure.
so yeah. First question is from Karina. How could we include early years centers members' family as mental health and well-being is a big part of a child's development? The first 5 years are so important in child development. How can we help the family and their child in the child care centers? That's a big question. Yeah.
That's a very big question and a really important question. And again, just highlights the need and the gaps in terms of services. And so I will say, I agree that is such a crucial developmental period, that 0 to 5, in terms of their little brain development, their social emotional development. And as it stands, the current STRONG program, while there's an elementary and a high school version, we generally say, based on the kind of cognitive abilities required to meaningfully participate in the program, we start at around grade 2. So that's certainly a really important area of need that I think altogether we could think about how can we more systematically come up with, whether it's a program or webinars or different services to really meet that developmental period, because unfortunately that's an age group that isn't adequately supported with the existing STRONG programs. But that's a great question.
And we have 3 other excellent questions. I think you could do a webinar. Maybe you'll do another webinar in each one of them, but for consideration of time, I'm wondering, would the three of you be open if the people posting the questions, could they reach out to you directly?
Absolutely.
Yeah, that's great. Maybe set something up to have those questions answered. Yeah, yeah. So now it's the official thank you. Yeah, a huge and sincere thank you to all of you, our colleagues at Strong. You did an outstanding presentation, and I think Gina, you said at the beginning, it's such a big and important topic, but the three of you have, you condensed it perfectly for 1 hour. I think you whetted our appetite to learn more. One of the images that we can take away is that this is just the very, very tip of the iceberg. There's so much more that we need to know about and that you could have presented today. But with our time limitation, we would have to end it there. You gave us a great reflecting question, and I actually wrote it down. I'm taking this away with me. The question was, who is responsible for supporting the well-being of newcomers? And that is such an excellent question, reflective question to take back to our respective workplaces. And I'm thinking it's each of us and it's all of us, right? There has to be that collective. And your presentation was meaningful because all I see on my screen are lots of hearts. So right. So thank you so much, and perhaps you'll visit us again to do another webinar in the future. Okay.
Thank you very much for having us.
Oh, well, we really enjoyed you and the presentation. So in the sake of time, I just have a few minutes. Oh, there goes some more hearts. That's wonderful. I just have a few small items to share before we say goodbye and we go on our way. Thank you, Eric. I think you're going to be sharing a slide. Excellent. So we want to know that each one of you are warmly welcomed to our next webinar. It's December the 10th from 1 to 2, and that's Eastern Standard Time. The webinar is called Centering Black Youth, Wellbeing, Resources for Learning, Action, and Community Engagement. And it promises, just like this one today, to be an excellent one. We're very happy to have Dr. Cyril Cromwell and Rama Keong Gozi with us today, or on the 10th. And Aneta will be putting a registration link into the chat. And again, we invite you to join us for that webinar. Second thing that we are going to be sharing with you is a new hub tool. And I have to say, on behalf of the team, we're really proud to share this with you, our new knowledge product. Upstream Youth Substance Use Prevention Communication Toolkit. And the purpose of this toolkit is to help those who are working in primary prevention communicate what upstream youth substance use prevention is and why it matters. We have 4 different components to the toolkit. We have an annotated slide deck that comes with speaker's notes that you can use when you're communicating to your audience. We have a primer. It's 31 pages for some content and some context. We have a 5-minute video of the firsthand perspectives of what a project explains what their experience has been like using the substance prevention program. And we're really happy to feature Planet Youth Battlefield area and the Battle River Treaty 6 Health Center. It's a wonderful video. And lastly, we have an animation that's only 3 minutes long, but it really speaks, or really shows, I guess, in really clear images, what is upstream all about. And so those 4 things comprise our toolkit, and we welcome you to take a look at it. Aneta, thank you so much for putting it into the chat. Take a look at it and give us some feedback. We'd love to hear from you. When our webinar closes, you will get a pop-up feedback. Of course, you know that we like getting feedback from you on how well we do here at the Hub and sponsoring these different webinars. It's the same feedback as the one that just popped up just a few minutes ago in regard to the webinar. So if you did that one, it's not necessary to do this one. We'd just like you to have done one of them. And I think that's it. So we again say thank you to our presenters. Thank you to each one of you for joining us. And we'll say goodbye and take good care until we meet again.